Good morning. Thank you all so much for joining us. We have a variety of attendees here today, from staff and board members from United Ways across our state, to elected officials and their staffers, our nonprofit partners, and our active and engaged community members. Welcome everybody. We are thrilled to have you all here for the South Carolina release of the 2024 Alice in Focus Children's Report. I'm Dale Douthit, President and CEO of United Way of the Lowcountry, serving Beaufort and Jasper counties, and I will be your co-host this morning, along with my colleague Natasha Chapman from Trident United Way.
Thank you, Dale, and welcome everyone. I am Natasha Chapman, the Chief Impact Officer of Trident United Way, based in North Charleston, serving the Tri-County area of Berkeley, Charleston, and Dorchester counties. We appreciate all of you joining us today to hear more about the critical new report from United for Alice. Please place your questions in the chat as we go along. Staff will be monitoring and responding along the way, as well as addressing those questions during the Q&A session. Please also include your email address with your questions so that if we are unable to answer today, we will circle back to you at a later time. In South Carolina, United Ways across the state are working to utilize ALICE data in our communities. Let's hear from a few of our local United Way partners.
United Way of Anderson County.
Black River United Way.
United Way of Lawrence County.
United Way of Greenville County.
United Way of the Lakelands.
United Way of Lancaster County.
United Way of the Lowcountry.
United Way of the Piedmont.
United Way of York County.
United Way of Sumter, Clarendon, and Lee counties.
United Way of Pickens County.
United Way of Aiken County.
United Way of Oconee County.
United Way of Horry County.
Thank you everyone. We're so glad to see you all here today. This statewide partnership is so impactful for our efforts within the ALICE framework. For those of you who are new to the work, ALICE is an acronym that stands for Asset Limited, Income Constrained, Employed, and it represents individuals and families in our communities who are working hard, yet still struggling to afford the cost of basic necessities. The ALICE framework is a data set, body of research, and one of the lenses that we use to determine the areas of need within our communities. We believe that this data is more comprehensive and precise than the outdated federal poverty line, and therefore more applicable as a means of determining need in any given community. ALICE is also a term used to describe populations in need of financial support in order to afford basic necessities like housing, food, utilities, and childcare. We're so grateful to each of our colleagues for their dedication and shared efforts in this critical work. As part of this statewide partnership, we come together every other month to share ideas, successes, pain points, and collaborate in any way we can. Another way several of our organizations partner is with VITA. VITA, or the Volunteer Income Tax Assistance Program, is an internal revenue service initiative that the United States that supports free tax preparation services for the underserved through various partner organizations, including United Ways. Cody Carver, Director of Community Initiatives and Investments, is with us today to share more about this program and the impact United Way of Greenville County has seen since implementing it, and the benefits of partnering with other local United Ways in this initiative. Cody, welcome. Thank you so much for being here.
Hello, and thank you for joining us today. I'm Cody Carver, the Director of Community Initiatives and Investments with United Way of Greenville County, and I'm excited to share with you the important work we're doing to support families across our state, especially those who are a part of the ALICE population, asset limited, income constrained, employed. As many of you know, ALICE families are the backbone of our communities. They are the child care providers, grocery store workers, and healthcare aides. People who work hard every day to support their families, yet still struggle to make ends meet. These families live paycheck to paycheck, often facing impossible choices like whether to pay the rent or keep food on the table. When it comes to their children, the stakes are even higher. Children in ALICE families often go without the essentials that many of us take for granted. Things like a secure home, access to healthcare, or educational opportunities that can set them on a path to success. That's where the Volunteer Income Tax Assistance, or VITA program, comes in. United Way of Greenville County leads a coalition of United Ways from across the state to implement the VITA program in local communities. Through our VITA program, we provide free tax preparation services to individuals and families who need it most, ensuring they receive the tax credits and refunds they are entitled to. For many Alice families, tax season is a time of great uncertainty. Without professional assistance, they might miss out on crucial tax credits and refunds that could make a significant difference in their financial stability. That's why our VITA program is so essential. It ensures that these families receive every dollar they're entitled to. In the 2024 tax year alone, our coalition filed nearly 10,000 tax returns. But the impact goes far beyond just filing taxes. We helped bring back $1.9 million in child tax credits and $2.7 million in earned income tax credits to hard-working Alice families across our state. That's over $4.6 million in critical funds that directly support the well-being of children and their families. To put this into perspective, these tax credits can cover months of rent, provide food security, or pay for medical expenses. For many families, it means the ability to invest in their children's education, purchase school supplies, or even save for the future. The impact of these funds is profound and far-reaching. These tax credits make a significant difference for Alice families. They can mean the difference between financial stability and hardship. And when we invest in these families, we're not just helping them today, we're building a stronger, more resilient future for their children. As we launch the Alice in Focus report, it's important to remember that behind every statistic is a child, a family, and a story. Our VITA program is one way we're making a tangible difference in the lives of Alice families, ensuring they have the resources they need to thrive. I encourage you to think about the ripple effect this support creates, not just for the families we serve, but for our entire community. By investing in Alice families, we are investing in the future of South Carolina. Thank you for your continued commitment to this important work. Together, we can create a brighter, more equitable future for every child and for every Alice family in our state.
Thank you, Cody. I really appreciate hearing about Greenville County's work and look forward to implementing some similar tactics here at My United Way. Thank you for all that you do. Now we'd like to move into sharing some details on the latest Alice in Focus Children's Report. I'm happy to introduce Katie Reams, our Director of United for Alice for the state of South Carolina. Katie is based out of our Trident United Way office here in North Charleston, and she is an invaluable colleague on my community impact team. Katie will be diving into some of the report findings and sharing some key statistics. Hi, Katie. Welcome.
Good morning, and thank you so much for joining us for the release of the Alice in Focus Children Report. My name is Katie Reams, and I am the director of the Alice Initiative here in South Carolina. We have a wonderful statewide partnership with 15 local United Ways here in South Carolina. We are so grateful for their support and for the work across South Carolina. And over the next few minutes, we will walk through what this report talks about and introduces for the children living in Alice households in South Carolina. So we've talked a lot about what that acronym ALICE and what does that mean. So let's walk through that a little bit so that we're all on the same page. ALICE is an acronym for Asset Limited Income Constrained Employed. What that means is these are households that are living above the federal poverty level, but not making enough to make ends meet and often can't support the basic needs in a household. Those often involve the categories of things like childcare, transportation, food, and really limits the access of things that those households are able to supply both for the adults and children in the household. We know that the number of children growing up in financial hardship in the United States is drastically higher than has widely been reported. So what these two reports will focus on is both national numbers and the numbers here in South Carolina. In the United States, the according to the outdated federal poverty level, 16% of children, which is 11.6 million, lived in poverty in 2022. Yet United for Alice data shows that another 34%, or 24.6 million, more than twice as many, were also growing up in financial hardship. These children lived in households that are ALICE, asset limited, income constrained, employed, earning above the federal poverty line, but not enough to afford the basics in their communities. With poverty level and ALICE households combined, which is what we call the ALICE threshold, a combined substantial 50% of the 72.1 million children in the United States lived in a household with the income below the ALICE threshold of financial survival, which means they often lacked access to crucial resources. Now let's break down a little bit about what that looks like specifically in South Carolina. With poverty level and ALICE households, again, that ALICE threshold is what we're discussing, which is what the households that we as the local United Ways in South Carolina support. We support both households that are ALICE and fall at or below the ALICE threshold. A substantial amount, 53% of the 1.1 million children in South Carolina lived in a household with income below the ALICE threshold of financial survival in 2022, ranking South Carolina 38th among all the states in D.C. ALICE households often do not earn enough to afford housing, childcare, food, transportation, health care, or technology, which are the basics to live and work in our communities in South Carolina. Based on this report, we know that the child tax credit and the dependent care tax credits that we saw helped many families with children get through the pandemic from 2019 to 2022. South Carolina in those years saw a decrease in households with children living in financially insecure households from 55% to 53%. Children under 18 in South Carolina's financially insecure households are from all locations and demographic groups. They are all ages. They are born in the United States and abroad. They are of all abilities. They are of all races and ethnicities, and they live with parents and guardians who are married, single, working, and sometimes not working. They're English speaking, non-English speaking, and any combination of the above. The percentage of children living in households below the ALICE threshold varies by community across the state, ranging from 66% in North Charleston to 56% in Pickens and Oconee counties to 57% in Sumter and Lee counties and 47% in Chester, Fairfield, and Lancaster counties. The rates of financial hardship are higher for infants and toddlers at 60%, and preschool-aged children 58%, than for school-aged children at 51%. Additionally, due to systemic barriers in financial stability, the share of children below the threshold was higher for some groups. 75% of Black children and 72% of American Indian and Alaska Native children, as well as 66% of Hispanic children, are living in households experiencing financial hardship. 13% of all South Carolina children, which makes it 149,298, lived in a home with a grandparent, which included both multi-generational households and households where grandparents were raising grandchildren on their own. Nearly 2/3, at 64%, of children in these households were below the ALICE threshold. Most children, 94%, lived in a household with at least one worker. But while parents and guardians work in every sector, children below the ALICE threshold are concentrated in families where adults work in occupations with low median hourly wages. These include some of the most common occupations in the state: For example, 72% of South Carolinian children with an adult working as a cashier earning a median wage of $11.23 per hour were below the threshold in 2022. So what does all of this mean? It's important for us to understand that while this is a lot of different statistics and numbers, how does that impact our families and how does that impact our children directly? Well, children in families below the ALICE threshold are more likely to lack stable housing, quality childcare, and early education. They're also less likely to be able to afford private health insurance or have high-speed internet at home. Also, reliable food access is a regular concern. Both short-term and long-term impacts come into effect. Children without stable housing often face poor physical health, increased family stress, and lower academic performance. We know that these impact things long-term for kiddos, and with the increase of things like e-learning days in school systems, access to high-speed internet is more crucial to the success of children in school than ever before. 24% of households below the ALICE threshold do not have access to high-speed internet, with 141,265 children in South Carolina not having access to high-speed internet in their homes. We know that academic performance will continue to be impacted. So what do we do? What's next for us here in the state of South Carolina and directly with our local United Ways across the state? Getting households connected to the right resources is key. In South Carolina, the SNAP program was utilized by only 59% of children in poverty and a mere 25% of children in ALICE households in 2022. So what we hope for, as you heard our local United Ways talk about, and we'll continue to hear them discuss, what we hope for is to get our communities connected with the right resources. Connect with your local United Way to learn more about how they're supporting ALICE households and engaging with your community leaders to affect change. We also encourage that you volunteer or donate using your time and talent to really connect with the work that's already happening in your community now. We'll follow up with an email sharing these reports and the United for Alice website. The United for Alice website has an incredible array of tools that will give you access to this data and more about what's happening in the households, both with our kiddos in South Carolina and our households overall. We'll also be able to share with you other ways to get involved with this work and make a difference right within your community directly. We're so excited that you joined us today and are passionate about the work of United Ways in your community and about the work that we are continuing to do to uplift and support ALICE households. Thank you.
Thank you, Katie, for providing background information on the ALICE in Focus report and for sharing some of the specific findings for South Carolina. While we all know too well the many ways in which financial instability impacts families in our state and across the nation, the findings of today's report can be particularly difficult as they specifically focus on children. While this is difficult, we're not without hope. Our United Way State Association is focused on reinstating the child tax credit, which is shown in the data that we just saw to have a huge benefit to the children in our community. We also know that with concrete, well-researched data like the ALICE reports provided by the United Way of Northern New Jersey, we have clear, solid footing to push for impactful change. Working together, focused on a clear direction, we can improve the lives of children, families, and individuals in every part of our state. Now we're going to hear from Kissy Melvin, Community Resource Coordinator at the United Way of Horry County. Welcome, Kissy, and thank you for joining us.
Hello, my name is Kissy Melvin, and I'm the Community Resource Coordinator for the United Way of Horry County. And today I want to take a moment to talk about two critical programs that are making a meaningful impact in our community. South Carolina Thrive, and the ALICE program, and how these initiatives work hand in hand to support families in need. So first, let's talk about South Carolina Thrive. This incredible program provides access to resources and benefits that can often be difficult to navigate, from healthcare assistance and SNAP applications to housing resources and tax filing support. South Carolina Thrives helps to connect individuals with the services they need to thrive in South Carolina. By offering a centralized point of contact and assistance, South Carolina Thrive empowers families to overcome barriers to self-sufficiency. It helps them to find and secure the resources they need to achieve financial stability and lead healthier and more secure lives. Now let's talk about the ALICE program, which stands for Assets Limited, Income Constrained, but Employed. These are individuals and families who are working but still struggle to make ends meet. ALICE families earn above the federal poverty level, yet they don't earn enough to afford basic necessities like housing, childcare, food, transportation, and health care. Here in Horry County, many of the families we serve fall into this category. ALICE families are often one unexpected expense away from a financial crisis, whether it's a car repair, medical bill, or loss of income. That's where programs like South Carolina Thrive come in. And the way that it works for these families in South Carolina, this has become a game changer. It helps fill in the gaps between offering assistance and access to financial assistance and public benefits that can help these families stay afloat. Whether it's helping them with a utility bill, finding affordable health care, or accessing nutritional assistance, South Carolina Thrive ensures that ALICE families can secure the support they need during tough times. Through the United Way of Horry County, we work closely with South Carolina Thrive to connect our ALICE families to these resources by bridging the gap between their income and their essential needs. We can help them move from just surviving to thriving. At United Way of Horry County, we are committed to uplifting the ALICE population in our community. By leveraging the power of South Carolina Thrive and our partnerships, we can help families find the stability they deserve. And together, we can build a stronger, more resilient community. And that is definitely the way to thrive. Thank you.
Thank you, Kissy, for sharing Horry County's work with South Carolina Thrive. Before we move to Q&A, I would like to introduce you all to just one more guest. HALOS is a nonprofit organization that promotes safe and nurturing homes for children in kinship care. When a family member or a close family friend steps up to take on the child who cannot live with their parents, it is an incredible gesture of love, compassion, and community. Unfortunately, many who take on these children often find themselves in situations of financial hardship, even if all before they were considered financially stable. HALOS provides a comprehensive system of support for kinship families so that caregivers and children can thrive together. Earlier this year, HALOS was awarded a Changemaker grant from Trident United Way specifically to support their work around ALICE families. We are honored to have with us today Ms. Kalila Sumner, Senior Director of Programs, to talk about their work with ALICE families and how the grant funded by a local donor helped to support their work. Welcome, Kalila. Thank you for being here and all that you do for our community.
Good morning. My name is Kalila Sumner. I'm Director of Programs at HALOS. At HALOS, we work to make sure that kinship children stay in their families. These are grandmas, grandpas, aunts, uncles who have taken in children when their biological families cannot raise them. We call them our HALOS heroes. We work to support, empower, and advocate for families. Well, overall, the Changemaker grants are really used to support those families in the time where they are the most stressed. We want to make sure that we are helping families stay in their homes because, Johnny's been going to grandma's for a while and for his whole life. And if he's 11 years old and grandma's where he's going, we want to help grandma keep the lights on. We want to make sure that grandma has adequate food until her SNAP benefits kick in. So we have used some of that money to make sure that families have groceries. We've also provided transportation assistance. So if grandma's taking public transportation and now she has to go to daycare, a summer camp, and back home, we want to provide the bus passes for them. We've also provided rental assistance. And so we want to make sure that those families are able to stay in the homes where those children go. We want to make sure that they're stable and secure in the spaces that they've been. If we didn't have these grants, we would have to refer out to agencies that don't always have the funding. And then we would really have to try to figure out with grant families how they can balance. These grants have really helped us keep families safe, secure, provide stability for those children and their families. And it's not often that grand families want to reach out and ask for help. They really feel horrible when they have to reach out and ask for help. But for us to be able to give them a yes is amazing for Halos. Amazing.
Thank you so much, Kalila. The work that you do in the community is truly incredible, and we really appreciate you sharing and providing us an opportunity to learn more about your organization and more about ways in which we can help children in our local areas. As we begin to wrap up our time today, you might be thinking, what next? What can I do to help? Well, here are some ways that you can help. Learn. Continue to educate yourself and others about ALICE. Read the detailed report. Share this information with your network. Advocate for policies at the local, state, and national levels that support ALICE families in South Carolina and across the country. And give. Give of your time, your talent, or your treasure. Every bit helps because, as we like to say in our organization, united, we thrive. Thank you all again for participating today. Now we're going to open the floor for questions. Katie Reams, Director of United for ALICE, DJ Hampton, President and CEO of Trident United Way, Paige Stevenson, President and CEO of United Way of Piedmont, and Cameron Campbell, President of United Way of Florence County, are all here to answer any questions you might have.
And thank you everyone for taking the time to share your questions with our United Way team. Please continue to share your questions along with your email, and our team will follow up with you if we're not able to answer your question today. So let's start with our first question. How can we engage with elected officials? Cameron?
We at United Way of Florence County have been scheduling one-on-one ALICE presentations with our elected officials, and the response has been extremely encouraging. We're finding that ALICE really resonates, and we recognize the potential for ALICE to be a great unifier as we use this information to identify the issues and then work together to solve them. We're able to use the ALICE Legislative District tool to tailor presentations for legislators, which really makes the information particularly useful for them. This tool details demographic data and provides key takeaways specific to the districts they represent. Additionally, being able to analyze this data from a county, state, and national perspective is really helpful, and we're even able to compare different areas. ALICE data also uses federally recognized sources of information, so our legislators know that this is a resource they can trust, and the fact that it's updated regularly means that they can use it now and in the future.
That's awesome, Cameron. DJ, Paige, anything else to add on how we're engaging with our elected officials? Perfect.
Well, I'll just say more of the same that Cameron is doing and really putting this in front of them and helping them identify maybe some of those trends as far as what their constituents may or may not be accessing to help them face some of this challenges from a workplace and home life perspective.
Yeah, that's a great perspective, Paige. Yeah, we love that idea of that fact-based decision making for our legislators and really helping them have those data sets to go in and make those decisions for our communities. That's awesome. Perfect. Well, a great question that came in through our Q&A was surrounding SNAP benefits and what are the barriers and why is it that those benefits aren't utilized more by families? Any perspective on that? I know, Paige, that's something your community experiences a lot.
Yeah, so, and that's one of those great conversation points to have with your legislator, because with the ALICE data, you can see what is your ALICE population and then what is the utilization percentage as far as SNAP in your area. And there are a couple of things that really impact people's ability and their usage of SNAP. One of those, first off, is awareness. The fact that they may or may not be aware that they actually qualify for SNAP. That hasn't entered their mind. Possibly they are not accessing those benefits because of the stigma. Somebody who has been able to make ends meet, but we think about with the loss of the child tax credit, all of a sudden families that were doing fine, all of a sudden things swung, and now they're, because of the loss of that credit, they are struggling to make ends meet and they qualify, but there's a stigma surrounding it. So there's some work for us to do there as well. Technology barriers, you can apply online, but if you aren't tech savvy, as far as being able to, you've got questions filling out that form, or you don't have the access to the high-speed internet and those types of things, there's some difficulty there. And even if you wanted to go and apply in person, maybe you don't have reliable transportation, and so that transportation becomes a barrier for you as well. And then when we stop and think about our rural communities, how many retailers in their community actually take the SNAP benefit, that's a way that they can pay for the food that they need. And so that creates another barrier for them as well.
Yeah, that's great. And I think that's a really great perspective to offer. We recognize, I think that several of us having lived in different spaces in South Carolina, that each community is so different. And it depends whether you live in the upstate or in the Midlands or in this low country space where I am, that each of those experiences can be different and those barriers really vary. And so it's important that as our local United Ways are plugged into our communities, that we learn those intricacies of each community. So thank you for highlighting those, Paige. Another specific question that came up is why does the percentage of children below the ALICE threshold, as we just talked about the variances among the states, so why does that percentage of children below the ALICE threshold vary so much across the state? DJ, want to offer some perspective on that?
Yeah, great question. And I'm going to try to keep this simple, knowing it's a very complex issue. So please forgive me if I oversimplify a few points here. When we look across the state of South Carolina, we've got great differences in different regions of the state when it comes to access to employment, infrastructure, local social services, and the costs of living. And these differences play together to really shape where we see ALICE families. And it is overly simplified as a rural and urban divide, although there's a little bit of overlap, and I'm just going to keep it very high level. But what we see in the data is that rural areas face challenges related to low-wage industries, such as agriculture, manufacturing, and service industries. We also see in rural areas they have limited access to education and healthcare, and insufficient social services to meet the local needs. These combine in those towns to drive higher concentrations of ALICE families. Likewise, we see a different driver of ALICE households in urban areas. While it might offer more employment opportunities and better access to resources, these advantages are incredibly offset by higher costs of living, particularly in housing, transportation, and healthcare. And as a result, we see many families end up in precarious situations, even though they may be making a higher wage. The costs and associated interplays just add up. We then layer on top of this great differences between urban and rural areas when it comes to education and job training, difficulties in transportation to get to a job or to childcare, access to affordable childcare, and differences in density of public service and social programs. And it all just means you've got these confluence of things, meaning that regardless of where you are in the state, we've got some different drivers of ALICE populations. And in some places, those interplays are even higher. And what I really love about the ALICE report, though, is it's meant to help us understand the differences between areas. You know, when we spell out the differences in every zip code, every United Way has a chance to say, what are these unique interplays in my area? How much urban and how much rural do I have? And then they're able to say, what do we need to do to support our neighbors in our local community? And so thanks for the question. I think it's a great one.
Yeah, that's awesome. Thank you, DJ. We had a couple of quick questions in the chat that were really easy to answer. Is there additional data provided from the ALICE framework regarding child well-being other than what was shared today? And yes, there is tons more, guys. We will absolutely going to send the report out after this and include those links. They're in the chat now. You can go to the United for ALICE website and see that full report. Additionally, does ALICE have information regarding like single individual households or households without children? And again, yep, absolutely. We actually have information about all sorts of household compositions, which is lovely. And so if you're interested in additional information, again, accessing that website, we'll send out more report information after this with a follow-up email. So please make sure that you're accessing that as we send that out. And one other person asked, how can they, connect with us? I will put my email here in the chat. You can always email me and then let me know where you're located, and I will put you in touch with the right local United Way. And then if you're here in our area, you'll work with our team here at Trident United Way. So moving forward, these last two questions are going to be for everyone. The first one is, how do you see growing up in an ALICE household impacting the children in your specific community? Paige, we'll start with you.
Yeah, great. So whenever I think about the ALICE households and then how we are addressing issues, it is really necessary for us to be thinking about a two-generation approach and realize that as we are working with the families, we are also impacting the children as we are moving forward. And so specifically, thinking about things from a workforce perspective and thinking about now, the current workforce, as well as the future workforce. When folks are struggling to make ends meet, there is additional stress in that family. And we all know the research around how toxic stress impacts development of children and those types of things. When we're thinking about, though, from that workforce standpoint, and how we can help support not only the child, but the parent, somebody had put in the chat about affordable childcare. That helps to make sure that parent is able to be at work. They are not absent. And at the same time, we're building those little brains for the future. When we think about helping people and standing in the gap when they're struggling from a stable housing perspective, that is something where if you're not worried about where you're going to sleep tonight, that parent is able to be much more productive at work, but also from that child's perspective, wherever they are on their learning journey, they're able to be more present as well. When we think about that transportation piece, that is going to make sure that the kids are getting where they need to get, but also that leads to better retention rates with workforce, as well as when you think a little farther in the future, if those kinds of things are being addressed, then from that skills development standpoint, all of a sudden as an adult, you've got the ability to free up some brain space and think about those skills that you need to develop to progress. And And also that just sets a great example for the child who is in that household about continuing education and, broadening their horizons for what they can do in their life as they move forward.
That's awesome. Yeah, exactly, Paige. Cameron?
In Florence County, 51% of children are raised by a single parent or other family members. And we know that single female-headed households, which are the most common household makeup outside of married couples, tend to struggle the most financially, with 84% falling below the ALICE threshold. When a single parent is struggling to make ends meet, it becomes increasingly difficult for the child's developmental needs to be met, which leads into short-term challenges around kindergarten readiness, which then feeds into long-term challenges around career readiness, like Paige just mentioned.
Yeah, that's a great perspective. Kind of following with that question of like, is there more data beyond what we shared today? And one of those data pieces is that we know that kiddos in ALICE households are less likely to be enrolled in preschool than kiddos that are above the ALICE threshold. So some of those really key aspects of education and early childhood development are so crucial in our communities. And so I really appreciate that perspective, Cameron. DJ?
Yeah, and I'd love to pull the thread a little bit on the childcare question that came up in the chat. When we look at this, I would really like to focus it on children's readiness to learn by the time they get to kindergarten. And if we step back and look at what the ALICE report tells us, but also other data sources, South Carolina has a scary high rate of children not in affordable childcare that have a high quality curriculum. And you end up with this combination of a lack of number of daycares in rural and urban areas, coupled with a high cost, which means we essentially have a low number of kids in affordable childcare. If we just look at the Tri-County, which covers Berkeley, Dorchester, and Charleston counties, so a very large urban county and two large rural counties, we see around 29,000 ALICE families have a child in the home. And it lines up with a chamber report released last year that said in our area, 26,000 people who want to work, mostly women, are not working because they lack the resources or proximity to a quality childcare. And as a result, families have relatives or a neighbor or someone down the street step in if they can, or the parents staying home with the child. What we see, though, is an impact on kindergarten readiness assessments. We saw in 2022, according to the kindergarten readiness assessment data released by the school system, 18% of children in poverty demonstrated a readiness to learn, and 40 versus 44% of those who were not in poverty. And in the Tri-County, we see only 96 Tri-County 4-year-olds. Again, I'll say this, 96 Tri-County 4-year-olds who were in poverty were enrolled in 4K First Steps in 2022 out of the estimated 5,000 who would have qualified. It's really 2% of eligible kids. And so what we see is childcare expenses exceeding housing costs. If you've got 2 kids in daycare, families are having to choose between childcare to enable a spouse to work and get trainings to bring in more money. That takes a backseat to keeping a roof over your head. And then the cost is to all this is children do not enter school ready to learn and then are behind throughout the rest of their education time.
That's a super helpful perspective. Thank you for sharing that additional statistics on the readiness there. So last question before we let everybody kind of escape to the rest of their day. And again, this is for everyone. What's United Way doing to help? You know, I know personally, while I enjoy coming to learn about things, sometimes I leave a conference or a meeting and I'm like, cool, love that we talked about all this. What are we doing? So that's what we want to kind of wrap up with today, guys, is what are the practical steps that the local United Ways are taking in their regions to work with ALICE households and those falling under the ALICE threshold. DJ, we'll start back with you. Oh, you're muted, DJ.
It is not a Zoom without that happening to someone.
That's right, DJ. You hit the bingo card.
ALICE is one of the things I'm really excited about. And the reason why, it's a statewide partnership. Each United Way gets to leverage their focus of helping hardworking families and neighbors in their local community and address the needs that they need. If we step back and we look locally, At Trident United Way, we're partnering with a myriad number of agencies focused on the issues that affect Alice. And we're releasing the Changemaker grants quarterly, which enable us to give funds to those groups directly affecting the challenges that Alice and their families and kids are facing. I also am really excited for the collaborations and partnerships we're driving around adapting a lot of the mission investments we're making towards the root causes of the challenges that Alice families are facing. And so that's a little bit about what we're doing in Trident United Way. Thank you.
Awesome. Thanks so much. Paige?
Yeah, so here with United Way of the Piedmont, we cover Spartanburg, Union, and Cherokee counties. And so we have some different efforts in each of those areas, but probably our biggest piece is our Community Resource Coordinator program. There we're taking a two-gen approach with those families, but we have a CRC that is focused specifically on families who have housing stability issues, working with them. We have some that are school-based in elementary, as well as some middle schools. In that particular case, we actually have someone who is Latinx. Spanish is her first language. And so what we're trying to do there is, as we see non-English speaking households that are speaking Spanish rising in our area, we've been able to begin to work with those families and take a more deliberate, intentional approach there. We're working in Cherokee County, specifically with their McKinney-Vento program there. And then we are also embedded in USC Upstate, Converse, SMC, and SCC, so that we're working with those students, many who are first generation, or maybe they're non-traditional students who are returning to finish a degree. And so they may have dropped out before because of life. And so we want to make sure that they stay in. Our AmeriCorps program is actually focused on putting teacher support specialists in our high poverty schools, so that we're making sure that those families and those children have the things that they need to DJ's point. Maybe they came in a little behind, and this is to help them get up to speed. And another really exciting partnership is just beginning in Union County, and it is a Cradle to Career initiative in partnership with the school district, Partners for Rural Impact, as well as Spartanburg Academic Movement. And we're excited to see what that comprehensive community planning is going to do.
Yeah, thanks for highlighting both that deliberate outreach to specific communities that we don't always make that intentional connection with, and for talking about those partnerships, because one of the things that we certainly know and we work to highlight today is that we are not successful without our community partners.
Exactly.
And we are so grateful for our partners across the state, and really couldn't continue to do our work without them. All right, last but not least, Cameron.
I'm really excited to share that we recently implemented a new program called Barriers to Employment that will help Florence County residents overcome difficulties in gaining and sustaining employment, including challenges such as childcare, transportation, work equipment, and other expenses. It may not be something that we think of often, but the expenses of starting a new job before the steady paycheck begins can be prohibitive for many who have the opportunity and want to work. We believe that even relatively small investments can help Florence County families along the path to financial stability. And actually, the first person that we were able to assist through the program was a father who has 6 children, ranging from 9 years old to 1 month old. They were living in a hotel room in one of the most crime-ridden areas of town. And with the job that we were able to help him secure, he can move his family into a safe, stable home where the children will have a much greater opportunity to thrive. And that's what it's all about.
That's exactly right, Cameron. Thank you so much for sharing that specific story. And that's certainly what that work of Alice is about for us as the local United Ways of South Carolina, is creating spaces and new programs and services and funding opportunities that help nonprofits change their eligibility and intake, potentially away from the outdated federal poverty level to this new Alice threshold. Additionally, creating new programs and services that move individual households into spaces of financial stability, not just kind of band-aiding problems, but into spaces of true financial stability that is long-term thriving for them. That is our ultimate goal. And looking at those partnerships with our statewide agencies and our legislative officials to make those systemic changes. So thank you all so much for your time today, Paige, Cameron, and DJ, for your leadership in your communities and your time. Thank you to everyone that joined us today and for the release of the children's report. We are so grateful for everyone. And please look for the follow-up email and connect with your local United Way for next steps and ways to engage. Have a great day, everyone. Thank you.
Bye.